Hi, everybody. It's Dr. Young. Thank you for joining us today, Thursday. And like every week on Thursdays from 1 until 1:30 Eastern Standard Time, we have this meeting. And today we're going to be talking about fear-free veterinary medicine. And I have Devin Thomas on the line. She is a practice manager from the Richland Animal Clinic in Tennessee, and she's going to be talking to us about her journey into fear-free veterinary medicine and what it is, how she got her team motivated to do it, and the few ups and downs that she's had in that journey. So with that, I'm just going to ask her the first question, and then we'll just take it back and forth. She even has some demos for you, some props, and I think it's going to be a really great meeting. So thanks again for being online, and let's get started because we only have 30 minutes. So Devin, first of all, hello.
Hello. Hi.
It was nice meeting you earlier. And so first question, how did you become interested in fear-free veterinary medicine?
Well, I guess I was interested in it before I actually knew what it was. For the last year, I managed a practice for a veterinary board-certified dentist, and he was the first veterinarian that I ever worked with that was the most concerned about a patient's emotional well-being during their visit. He would make us turn off the lights when they were waking up from anesthesia. We would have to be quiet. I would hold the patient for 30 to 40 minutes, depending on what they needed after the procedure, to make sure they were calm before they finalized their recovery in their kennel. Quiet throughout the day. If an animal is overly loud, we would sedate it because that's obviously an indication of stress, and a lot more pain management than I've ever seen. And I know that some of his procedures were, warranted a lot more pain management, but I think that more procedures than we realized could use a higher level of pain management. So then I went to the Music City Veterinary Conference this past year and was able to meet Dr. Marty Becker, who has started this wonderful movement. And he said a couple of things that just made it all make sense. And one of them was something by Karen Overall. I'm going to read it to you. She actually published some things that said, fear is the worst thing that a social species can experience, and it causes permanent damage to the brain. So I think that's fascinating that we can scare the beings that we're trying to help so much into being completely afraid of us and damaging them in a way. So then they talked about, of course, the veterinary oath, and how important it is to not just do the physical suffering, but learn how to work with the emotional suffering. So with all of that, I've had several surgeries. I've had bad doctors and good experiences, and I've always projected myself and wanted comfort for my patients. But after hearing all of that, it's just increased the importance for me 100 times. So.
Mm-hmm. Excellent. Yeah, so that's really interesting that it actually causes permanent damage to the brain. That's a good thing to remember. So then you became inspired by it and excited, I'm sure. And so you wanted to bring it into your clinic. How did that process work? Did you have any pushback from the clinic owner? Was he or she right on board? And what about the team? Were they excited about it right away, or did you really have to figure out how to get them to be interested in it also?
The owner was pretty excited. She's a holistic veterinarian. She does both Eastern and Western medicine. The associate veterinarians just practice Western modern medicine, but she does acupuncture. We also have a chiropractor, so it fits really well with our practice and the message that we definitely want to put out there into the community. So she was on board. Now she's an older vet, probably pretty close to retirement. So it's hard to change habits. So that's been a little bit challenging with implementing changes in an exam you've done on a cat and dog your whole career. The team was extremely receptive to it. But again, it's the habits that you have to break that have been hard. You know, when I introduced this idea in our first meeting, and explained that I was going to be setting up a plan to go happen in phases so that we could train ourselves to do these new things, they jumped in. They offered up ideas. They came to me afterwards and suggested things that they had heard in other places, and so it was received pretty well. At this point, it's just the training and habitual changes that the team and I are working on.
So have you had somebody from the outside come in to speak to your team about this and to give presentations on the fear-free veterinary medicine, or is it just based on the information that you have learned and the knowledge that you have attained over, since you first heard about it?
It's a lot of what I heard and the literature I collected after Dr. Becker's presentation, and then other aspects are just learned, things that we've tried and are working for us and things that aren't. I would love to bring someone in, but it's still pretty new, so I don't necessarily have the access to someone, and I understand Dr. Becker is pretty expensive to bring in, so.
I bet. So when you were talking about the literature, do you have a list of books and magazines and internet articles that you can later on share with us?
Yes, I do.
That you would recommend, because I'm sure that you've done a lot of reading, and with anything, there's good articles, not so good articles, good books that you wish you hadn't bought, and other books that you wish you had. So can I ask you for a list of that later on, and I will send it out to everybody?
Yes, definitely.
Okay, excellent. So how different is it between, so you have a holistic vet, and you kind of just assume when you hear that a holistic vet is more prone to looking at the emotional aspect of an animal also, especially if they practice acupuncture or homeopathy, and even with chiropractic, you're just more in tune with the body as a whole instead of just the different parts. So I was surprised when you said that it was difficult for her to change her habits. So tell me about some of the habits that had to be changed to create a fear-free practice.
Dr. Brockman has bad knees, for example, and she can't get down on the floor with every patient, but a lot of patients prefer, especially a large dog, to be examined on the floor. It doesn't make sense for them to be up on a counter. Cats are all over the place, little dogs are being carried, but some, even medium-sized dogs get really upset and stressed the minute you go to pick them up to put them on the table. So that is hard for her because of her access to the patient. And then there's little things that are just so strange when you think about behaviors with pets that a veterinarian who was going to school at the time that she was don't know, like cats prefer to be examined from tail to nose instead of nose to tail. And you always, whenever you're even explaining the exam, you say nose to tail exam. So little changes like that are the hardest changes. She is definitely completely concerned about the emotional well-being, but maybe she didn't understand all of it before because the information hasn't been out there. It's new research, and pain management is a growing concern in veterinary medicine. And so just little things for her. And also she's very, very busy. And part of this is patience and time that you have to apply to your practice.
So yes, I imagine it takes a lot more time because you're basically developing a relationship with this animal and asking permission to examine it, to cross that fear barrier that you have. So have you actually changed the pricing structure in your clinic now that you're probably spending more time with the patients? Has that?
Not yet, but the one thing that the first change we're going to make is charging for a stool sample collection if we use the fecal loop, because we are encouraging clients to bring the stool sample with them. And that way we're not offending the patient. I mean, that can't be comfortable and you don't understand it. So that would be our first increase, and that is just a discouraging fee to kind of get the owner to, make that change for themselves. And eventually we will increase the charge for a dog with, we do already have difficult nail trims. Those are more expensive, but they would entail more things like sedatives, and so there would be little prices added on, and that we have already done, but we haven't made any definite price changes with exams. Her exams for a holistic exam would be an hour anyway, so she spends that time anyway, even if she gets double booked sometimes. But we haven't made any significant leap towards any changes that way yet. I mean,
Gotcha.
the conference was in February, so we're like very baby phase,
Right.
of this.
Excellent. Excellent. So are you using more pharmaceuticals?
We're trying to learn more about them. A lot of research has indicated that acepromazine, which has been a favorite for a lot of people, is not the best sedative for an anxious dog. They, talk about trazodone and what's the Xanax, the alprazolam, are much better, and cats, benefit from buprenorphine. And so just finding different ones, and not all medications are going to work for each vet. So kind of trial and error, and just instead of just strictly sedating them, removing the anxiety from the situation. There are sedatives and then there are anti-anxiety medications, and they do different things for a patient. So we've been using more alprazolam. We've been scripting out a little bit of trazodone, and we've definitely been using less acepromazine.
Gotcha. So are you educating your clients also, instead of just your team? Obviously for your team and the way the animals are handled within the clinic is probably a huge shift.
Yes.
But does that also carry over into the clients and what they should do at home, or how they can prepare the animal to come into the clinic, so that they have a voice in this also?
Yes, delivering a calm patient, of course, is the most ideal. A lot of it is education, which is great because we want to be educating our clients anyway. But it's just adding to that education, which ultimately I have seen increased compliance through, which I love. But you talk to them about the pheromones, and every time I have a cat exam now, I spray some pheromones, and so does my whole team. And then that just starts the conversation about what pheromones are. And I sell little bottles of pheromones, and those people spray it before they come in with their cat. And little things like keeping the carrier flat, keeping it covered, because everyone wants their cat to see everything, but cats don't actually enjoy that. It stresses them out more. Dogs, instead of talking to them and saying, it's okay, it's okay, it's okay, you're creating that stressful event because they're reading your language. So, they're excited when they get in the car. So let them be excited and just leave that alone, instead of when you pull into the vet and maybe they're getting a little nervous, ignore the behavior, because otherwise you're feeding it. And so just little things like that. And that's harder for clients to realize that they are adding to it. And also when a client is in the clinic and they say, oh, they just don't like it here, redirecting that comment and saying, oh, well, we're doing these things to make it so it's not as stressful of an event for them. And here's what you can try to help us do that. So starting that conversation with clients is very important in their compliance with anti-anxiety methods for their patient.
Now, do you have those conversations? It sounds like you have those conversations, obviously, on an individual basis. Do you also have it structured in your clinic that now you're educating, you're asking your clients to come in, say, after hours on the weekends or something, to actually have lectures or training, so to speak, for them in group settings? Have you thought about that? Are you doing that?
That's a good idea. I'm writing that down.
I love it when I can give great ideas. So then the other question that I had, I haven't looked at your website. Is that information on your website that you are going fear-free, that that's something that you're concentrating on, And do you give that heads up to your new clients or your old clients if they go to your website?
We haven't put it on the website yet. I think that we need to make a few internal changes before we can truly claim that we're making that movement. And I would like to do that by the end of the year, but I just don't think that everyone's ready enough to talk about it in order to have clients come into the clinic and ask the questions that will be asked if that's what they see on our website. Now, if someone asks about the pheromones and the things that I'm introducing to them, I will explain that that's what we're doing. So it's just very individual basis right now, and by the end of the year, I'd like to have it up on the website.
Excellent. How big is your clinic? How many doctors do you have working there, and how many support staff?
We have a chiropractor, and he works twice a week, just in the afternoon. We have Dr. Brockman, the owner. She works almost full-time, not quite. 2 associate veterinarians that are full-time, and then a part-time veterinarian that works usually just Mondays, but she fills in here and there. We probably have about 15 support staff right now. We have a couple of part-timers that are kind of on the edges of that. So. Okay.
And so how are you introducing that to the team as a whole?
We have meetings. We started with phase 1, and we're moving to phase 2 of making some changes in the clinic. And then I just try to be aware when I see something that could be corrected. I just try and make sure I voice that and then share it at the next meeting. I saw a few weeks ago someone waking up a patient from anesthesia and doing the bang on their chest, and I yelled at the person. I apologize, but it startled me because I don't think they associated the fear-free with all aspects of medicine, and a patient doesn't know why we put them under anesthesia in the first place. So waking up like that, I mean, I can't imagine how just confusing and scary that would be.
Right. So when you do the meetings that you have, do you show videos? Is it just a training, basically, like a lecture, or how does that go?
It's a little lecture and it's a little interactive. So they share experiences that have worked for them, because everyone's all over our clinic at all times. So I share what I've seen work. They tell me what's working, what's not working, and then I'll introduce new things that we're going to try. Like we watched the video for the clipnosis that I showed you before we started, which if you want me to show, I will.
Yeah, give it just a couple more minutes, and then I will let you show the props, and I'll go and see if anybody has any questions.
Okay.
Yeah. So it's interactive. It's lecture and interactive and show and tell, basically.
Yeah.
I like that. So I just have the one thing that I was really wondering about, because with me, everything that I do is about the people problems within clinics. So, you guys deal with the animals, and I now deal with the people problems. So going to a fear-free practice for the animals, how has that affected your clinic as a whole, as far as your team members? Have you noticed any changes in how they interact with each other?
I'm, of course, in veterinary clinics, there's some humor. So when a dog's getting stressed, they'll make a joke about, oh, that's not fear-free. And so that's bound to happen, of course. But I've noticed my employees are applying themselves in different ways. Like I said, when I introduce it, they still come to me and say, I read this. Or one of my veterinarians is she was sick one day and she came to me the next day and said, oh my gosh, I was reading this and we can use it this way. So I think the application of something new is kind of exciting and something that they can do themselves, and it's not just medicine, that everyone can be involved in this change. I think that's been pretty positive, because no one's necessarily more important in the change than anyone else. It's a whole change, and that way no one's excluded and no one has to work harder than someone else, and everyone's on the same level. So I think that's been pretty positive. People just applying themselves to make it work.
Excellent. I love that. Yep. So we have 10 minutes left, and I can ask more questions, but I thought I would see if anybody on the call has questions while you go ahead and show us the props.
Okay.
And I actually have some questions about them for you also. Okay. But yeah, just let us look at the props and take your time, and I will write a little chat in the chat box. But if anybody has any questions, if you go to the right side of your screen, in the bottom, there's a chat box. If you just write your question in there, and then I will pass it on to Devin and hope to get it answered for you.
Okay, so I spoke a little bit about pheromones. We use our pheromones in the room. We have a cat room. One of our exam rooms is specifically dedicated to cats, and we use the diffusers in there all the time, try to keep the doors shut when there's not a foul smell that needs to air out. But that way, multi-cat diffusers that are also used for aggressive cats are already going in there. The smell's already in there, and it does help the cat patients that have come into our clinic. We have the spray, and they do have clinic sizes, and we just spray ourselves. We spray the cages before they go in. We spray the carriers when they're going to go home, when they come in, the exam table, everything. There's also a dog version, the Adaptil. I like it. I don't think it's been as effective in the spray form. A couple of our patients have bought the collars, and that seems to work well, but you do have to leave them on. But Dr. Brockman's dog actually is kind of wild, and he just toned down a few notches when he would wear the collar. There are sprays and wipes, mostly for feel away, because they've seen more success with the cat pheromones. We have our cat bags, which I think most clinics have seen these, but I think they work really well for specific patients. Our kidney patients that get fluids regularly, I've seen the most use for them. They get in their cat bag, and instead of someone having to hold them down and making fluids a stressful experience, they kind of just hang out in the bag. Then we unzip it in the back a little bit, and we can administer their fluids, and no one has to hold on to them, but they're still kind of in an enclosed, safe space. And we have noise makers or sound machines in our clinic that we keep in the treatment area and in our kennel, and they kind of are just a white noise, and it kind of drowns out other noises. We are administering the half-dose vaccines, which is great for a smaller pet. And small cats, small dogs. We use them for large dogs as well, but there's less junk in the vaccine, and that works really well.
Can you hold that up again?
Oh,
half-dose vaccine chart.
Yeah. Let's see.
Just the front of it so we can see that.
This is just kind of a little brochure.
Okay, from Boehringer Ingelheim. Okay.
Yeah. And they're, what are they called? They're Ultra Duramune for dogs and Filovax for cats.
Okay. Yep.
We, of course, need to document when we have these patients come in and we find things that work for them and things that don't work for them. So I've made these little summary sheets that are attached to each patient's folder. And every time they come in, if we realize something that we need to notate, for example, I have my dog on here, and her name is Dora. She likes it when I have music on in the car because she's very anxious in the car, so just some sort of classical music. Her favorite treat is cheese, so we're going to offer that as often as possible to associate the vet with a rewarding experience. She hates her nails trimmed, so we need to find a way to make that work, and I'm still working on that with my dog, so there's no solution yet. And she is much better in an exam if her older sister is present. So knowing that when I schedule her exam, if I see those notes, I can make sure to remind the owner if something worked or didn't work, or that they need to do, or if she hates, her stool being collected, then we definitely want to make sure that the owner brings it, or we're not going to collect it because the patient hates it so much. And then one of my favorites is the Clipnosis. And this is like a little bag clip. And they do have videos on them. I think they have them online, but it's for scruffing a cat. Some cats use one, some cats use four. And the idea is to use it before the cat becomes stressed. You put it on the cat, just on the scruff, and the cat will kind of just sit there, switch their tail a little bit, and then they'll kind of lean to one side and fall over. And if they're not responding, you can add more. But we do our ultrasounds without anyone really holding the cat, and it'll lay down. Typically, they lay down on their dominant. I think their dominant side is down, and you can do. I've done nail trims all by myself for cats in rooms, and the cat's kneading and purring, and so I really like that. That's one of my favorites.
So I have a question that I just want to throw at you. It's from Nicole. I'm the manager of a vet clinic and boarding facility.
Okay.
When we built the boarding facility, we wanted to make it as stress-free as possible for the pets. We use through a dog's ear music. Have you heard of this, and what do you think? Any other ideas for making boarding experiences less stressful?
I have heard of it, and they do speak highly of the music. I would be interested in hearing how it's working for you, or if you have noticed a difference. We also use the sound machines, and the biggest thing with a kennel is that all dogs are going to have different ideas about what's comfortable for them. And so hopefully you have areas where an older dog can be separated from a wild puppy, or you cover up a dog during walks if he's specifically aggressive. Kennels are hard because they're staying there, and a lot of them don't love it. So long-term sedatives that you can use, trazodone if they're really, really upset about being in the kennel. And then a lot of training. In my kennel, all the dogs run back to their kennel after their walk because they know that there's a treat there. All of them. Even if they've been there for 1-2 days, they know that that treat is there. And so finding ways to make the kennel experience positive is going to be the key to make it the ideal place for them to feel relaxed.
Excellent. So the sound machine that you were talking about, is that a specific model or make?
Nope. We have a couple of different ones. One has kind of an outdoor sound like nighttime with crickets. And then we have just the white noise, and I just got them on Amazon.
Okay. What about lights? You were talking earlier with me about turning the lights off in the surgery room, or post surgery. What about in the kennel? Do you have different lights in the kennel? I know we like to use the fluorescent lights in the kennels.
We usually only have our fluorescents on during walks and cleanup, and then we just have windows, so we have natural light during the day. Unfortunately, we have some parts of our hospital that don't have windows, and I don't like the lights off at all times, so we'll have those fluorescent lights on during the day. But other than that, the cat ward and the dog run area both have natural lighting during the day, and the fluorescents are off after cleanup.
Excellent. Gosh, I just had one more question and it's gone. Hate when that happens. So on the clips that you were talking about earlier, what are those called again?
Clipnosis. Here, I have
Clipnosis.
There's a disc that it comes. Oops, there we go.
Yeah.
And they're really inexpensive. They're kitten size and adult size, and if you remember to use them before a cat's upset and the treatment isn't super invasive, they work so well.
And you said you sometimes put more than just one on a cat.
And then I just notate on their patient profile. Abby did well with 3 clipnosises for her nail trim.
Is Abby a dog or a cat?
A cat.
I only works on cats. Okay.
Yes. Yeah.
Excellent. Very good. Well, it is 1:30. I think we covered everything.
Okay.
I know that people were asking about, the resources. They really loved the session. So if you can pass the resources on to me, and then I will include them in the replay email that I sent out to everybody, I will do that.
Okay.
And just wanted to remind everybody that these webinars are every Thursday between 1 and 1:30 Eastern Standard Time. I send out the invites, but please feel free to pass them on to other people in the veterinary industry. I would love to grow this a little bit more. And you can also get in touch with me by joining my group on LinkedIn. It's called Beyond Veterinary Practice Management. And that's how Devin and I actually met the very first time. So Devin, thank you very, very much for this very informative webinar. It was great. And I wish you much success, and let us know as you go through your journey what else you discover, and we'd love to hear back from you.
All right. Thank you very much.
You're welcome. Bye-bye, everybody.